amazes me every time I hear about what was in those pits. And you could see them from miles away. I was flying recon missions 30,000 feet in the air, and I could see the columns hundreds of miles away. Some of those barracks were right next to them. I wonder if Bernie Moreno would build a house next to one of those pits, or put one of his offices or one of his dealerships next to one of those pits. It's amazing to me that the so-called leaders who are quickest with the pen to make cuts are the ones who've never had to risk that kind of thing, ever. Much less show up in front of your constituents. When you are terrified of your constituents, maybe you don't deserve the title senator.
That's right.
Our next speaker is a medical doctor, Dr. Lavin of Shaker Heights, a pediatrician with nearly 40 years of experience and the chair of Doctors Organized for Healthcare Solutions. For decades, Dr. Lavin has sat across from parents struggling with vaccine hesitancy, listening to their fears, answering their questions, and working to ensure that every child in his exam room is protected from preventable disease. He has seen firsthand one family's choice to opt out of immunizations can put entire communities at risk. Dr. Lavin is also my kid's pediatrician. And my oldest is 19 now, 15 and 12. They haven't been in your office for a while, but I want to share a story about Lizzie with you, who, as you know, when she was born, actually the first time I started to care about politics was when the nurse who helped deliver Lizzie said, "Brace yourself." And my little girl, she needed 4 really tough surgeries as a baby to help repair her mouth and her jaw, and the doctor said she'll probably never really talk, or certainly in a way that you'll be able to understand what she's saying. That wasn't Dr. Lavin. That was her surgeon. Last week, she came home from trying out for a part in the musical Cinderella. And she said, "Dad, I got the part."
Oh.
And I said, what part? Are you a mouse? Are you a pumpkin? And she said, "Dad, I'm Cinderella." Thank you, Dr. Lavin, for being our doctor and for taking care of our kids. And please convey just how much is at stake with the cuts that we're about to face. Okay, thank you.
I'm overwhelmed. Thank you, Sarah. I mean, the story really shook me up, and it's just incredible that there's 5 or 6 shocking stories to tell tonight. You know, a lot of us might ask, and thank you, Ken, and congratulations to Cinderella. It is a real Cinderella story, isn't it? A lot of us might ask, where's Bernie Moreno, but not me? Because I know exactly where he is. He's with the people he cares about. There's only 2 of them. You know their names, Musk and Trump. He cares about what they need, and he's working hard to provide for those needs. And he's made it quite clear he doesn't care about Sarah's story or my story, any of the other speaker stories, anyone here tonight. And I want to say again what Ken has said. We haven't seen rooms like this in American history for a long time. I love town halls now. How about you all? And I'm reminded that town halls began the American Revolution. Because what's democracy? Democracy is a system in which the people's real needs are heard and addressed. Tonight we heard a real need. And we're going to make sure it gets addressed. And we're going to hear other real needs. So I know that he doesn't care about our needs and our stories. He doesn't want to hear the stories. But what are the needs and cares that he's ignoring? And as a doctor, I'm here to say that he doesn't care about our health. He doesn't care about our life. So you might say, healthcare have to do with democracy? And who here in the room has heard of Tim Snyder, who wrote, oh, okay, there we go, I'm in the right room. How many people have seen this book by him? Oh, wow, I'm impressed. So those who haven't, Tim Snyder got appendicitis, and he went from hospital to hospital, got terrible care. And while he was recovering, he was in the hospital for I don't know how many weeks, for appendicitis, for many weeks in the hospital. He wrote this book. Because what he came to realize was the deep, profound connection between health and democracy. Because if democracy is the ability of a nation to hear each person's needs and to respond to them, what greater failure can we have as a community to ignore the healthcare needs of our community and not respond to them? And so I'm going to talk tonight about 3 ways in which the current administration hasn't just failed, but has actually sought harm to each of us in 3 different ways when it comes to health. As a pediatrician, of course, I'm going to focus on children. Hope that's okay with folks. So the first is measles. I think everyone's heard of measles. The second one, I bet most of you haven't heard of. It's called the ACIP. Anyone hear of the ACIP? That's good. And the third is bird flu. They all have to do with immunizations. So I'll just be real quick on the measles story. Our group, Doctors Organized for Healthcare Solutions, joined Nurses for America, and a broad coalition of people tried to stop RFK. One of our doctors was in the room at the hearing for RFK, and she sat in a row of doctors in white coats and was vilified by most of the audience because they hated people who were standing up for science and care in the audience. So why were they there? Because when measles broke out in the country of Samoa in 2019, Robert F. Kennedy Jr. did what he could to stop people from getting the MMR. And he succeeded. Nurses in the midst of the measles epidemic told the governor of Hawaii, Josh Green, that his actions helped depress use of the MMR. Now what happened in Samoa? In the midst of the epidemic, when it was really flaring, Robert F. Kennedy wrote a letter, it's signed and anyone can get it online, to the Prime Minister of Samoa, in which he suggested that the measles vaccine was causing the epidemic. Just think about that for a moment. As a result, the island nation of Samoa began to run out of children's caskets because of what this man did. And the response of our Senate was to vote for him to be in charge. There we go. That's the right answer. So he's now head of HHS. Bill Cassidy, who's a gastroenterologist who made part of his fame, senator from Louisiana, got there because he helped immunize Louisiana against hepatitis B. It's one of his proudest achievements. I spoke to his staff with Nurses for America, and they said, don't worry about the vote for him because he knows that if he violates his promise not to go against immunizations, that the senator will be there to pull him in. Okay, so I know in America we have trouble hearing about other lands, but measles is here. It's in Texas. It's New Mexico. It's going to be all over the place because measles is very contagious. If a group of people go under 95% immunized, it begins to spread. So a child has died in Texas from a disease that they would never have to die from. The parents have to live with that death the rest of their life. And our head of HHS comes out onto the national stage with an action that can make sure no other child dies. How do I know that? Because in 2000, the United States had 95% plus immunization rates for measles. And guess how many cases of measles were in the United States in the year 2000? 0. When you have 0 cases, 0 people died. Because of the anti-vax efforts, measles is spreading. And when the head of our health services, HHS, goes onto the national stage to say that vitamin A is the way, cod liver oil is the way, and doesn't mention the one way that will save lives, he is guilty of promoting death to our children by measles. So that's one way. That's one way what's going on is hurting our health and overturning our democracy. A less familiar phrase is ACIP. I hope after tonight you'll never forget what this stands for. It's the Advisory Committee on Immunization Practice. It's the committee that meets at the CDC and decides which vaccination should everyone get. How many here have ever gotten an MMR? Okay. Now, did it cost anyone here a lot of money to get that MMR? Does anyone remember having to pay a lot of money? The only reason why it didn't cost a lot of money is because the federal law states that if the MMR is on the ACIP schedule, every insurance package in the United States has to pay for it. Now, all you have to do is drop MMR off the ACIP schedule, and insurance will no longer be obligated to pay for it. It will lose its liability protections. Manufacturers may stop making it. Robert Kennedy Jr. has decided to recast the ACIP. And with his people in place, he can drop MMR, he can drop meningitis, he can drop tetanus protections, every immunization you can think of. That step will lead to death of our children. And yet, Senator Bernie Moreno, who is somewhere, he's not here, but he's busy doing what he needs to do, has taken actions to help put us into this catastrophe. That's ACIP. The last example I'll share with you has to do with bird flu. So I think the most important thing about bird flu is that we had a bird flu pandemic in the world in 1918. We now know, it took a few decades actually, but we now know that the origin of that virus was from ducks in Kansas. So it was a bird flu. And the thing about bird flu is, as long as a virus can only infect your cell, it can unlock the combination. Each cell has like a safe, the virus has to find the right proteins on each cell to get inside and infect you. The proteins on duck cells are different than human cells. So a virus that can infect ducks typically cannot infect humans. And the ducks in Kansas could not infect humans until 1918. And then something like 100 million people were killed once it figured out how to get into humans, not just into humans, but transmit from human to human. So the bird flu that's out there now is spreading across chickens and ducks and all sorts of birds. And about 800 cases have been diagnosed in humans. But that means the virus has figured out the trick of unlocking the combination to the human cell. The reason why we're here tonight in this room safely is because the virus hasn't figured out yet how to go from my human cell to your human cell. So if you work on a duck farm and you get the bird flu, you're not going to spread it to anyone in your family because it only got into you because you're soaking in the bird flu virus. And it can push its way through without being very adept at doing so. But every time that a person gets the bird flu, the virus mutates, and one of these billion zillion times, the virus will pop out that can go from person to person, which is what happened with COVID and other such pandemics, including AIDS. AIDS, we believe, came from chimpanzees. It's the same story for all these catastrophes. Now, here's the deal. As of now, we know about 800 or so cases of bird flu in humans. So far, there's been not much evidence of any of those cases spreading to another human. But guess how many of those 800 people have died from their case of bird flu? About 400. If 800 people got COVID, we would expect less than 8 people to die. With this virus, it's 400. Now, what we don't know is that is whether when the virus changes, so it can spread from person to person, will it still kill half of the people that get infected? It may not. It may not. But we're dealing with a germ that is deadly. And if we let it loose and it maintains 50% mortality, and we have the same number of cases of bird flu as we had of COVID, then instead of 1 million people dying in the United States from COVID, it'd be 40 million. That would mean there'd be a pretty good chance, it'd be almost guaranteed that if we all got bird flu, a good chunk of us would be killed by it. And here's the good news. In 1918, there were no flu shots. So we had 100 million deaths. But it's still an influenza virus. So we know how to make flu shots, right? So we could make a shot for this bird flu virus, like we make any other flu shot. The problem is, the virus that would spread across billions of people and kill a good chunk of us hasn't come into existence yet. So you can't put it into a lab and make a vaccine for it yet. You can only do that once you know that you've got the virus. The only reason we have the COVID vaccine in time, in enough time to save, we believe the COVID vaccine saved about 2 million lives in the United States. The only reason that happened is because in China they got the genetic code of the COVID. Once the COVID virus was set to go and rip through humanity, we got the gene sequence within 24, 48 hours of that happening, and we were off to the races making the vaccine. If you don't know that the bird flu has figured out how to spread across humanity, if you don't get that virus into a lab and make the right flu shot for it, then there'll be no flu shot for the bird flu. Now, what's our chance of doing that right now under Robert F. Kennedy Jr.? Any guesses? Yeah. Here's how bad it is. The regular flu virus every year changes. So you have to take it it takes about 6 months to make the new batch. It comes to Ohio in the middle of December every year. So what's 6 months before that? June, right? So you've got to have your flu virus sequences in hand by April or so, or May. He stopped it. It's not happening. We're not making flu vaccine for this fall right now. And if we can't do that, what's our chance of being able to know? We left the World Health Organization, so our ability to go into various areas and find the bird flu virus when it can infect masses of people is gone. So from measles to ACIP to bird flu, we are in danger. And Bernie Moreno is actively doing his part to make sure we are in trouble. So thank you again for coming out. We love the town halls, and let's get democracy back in America.